even on a smaller scale, you can use Excel, you can have templates, but there is a distinct difference in my experience of somebody who is learning Excel on the fly, who's picking up prior person's template compared to an absolute Excel guru specialist who knows how to use Power Pivot and other advanced features, and even take Excel and connect it to a data warehousing solution or to other platforms as well. And you're always going to be limited by how much data you can manage within Excel. And hopefully, if you're listening to this, your practice has grown to the point where that's challenging to manage, meaning a million records, like a million line items. And so you always want to get access to detail. Hey everybody, this is Jason Brell, founder of Parable Associates. And the topic for discussion today is, when is it important to have a data team or a team of data professionals to support your practice compared to an in-house Excel guru or the most technical person in your practice, and leaning on them. And so to help guide us through the conversation, I have Erin Daniels with me. Erin has worked in multiple specialties. She served as a trainer in the SaaS side. She's also been in practice as well. So welcome to the call, Erin. Appreciate having you.
Thanks, Jason. Happy to be here.
So
love this topic too.
Yeah, it's a bit of a hot topic because I think there's an opportunity to educate the market, meaning the practices, because there is a threshold where you get to a certain size and scale and complexity in your business that having technical resources becomes to be an important thing. Mm-hmm. And a lot of these organizations are already trying to fill that with existing resources. So I guess let's just start there. What has your experience been like? Does that sound like a real situation to have somebody in your practice that becomes the Excel guru or the person that would lean into for analytics, but it's not really their job?
In my experience, it's usually kind of fallen onto me. We haven't had somebody, definitely come in and do that separately. But I have worked with other practices where they have brought in somebody separate just to be able to pull that information. And I think where some of it comes from, there's a little bit of in the past, sometimes even though a healthcare system is a business, it isn't always run as a business. So sometimes, nobody will be paying attention to the different KPIs and things like that. It's just kind of money in and money out. A couple of the other practices I've worked with, we actually had accountants. And so we would send all the information over to the accountants, and then they would come up with a monthly report, just a regular profit and loss. And then oftentimes it would also have, some additional information. But if we were looking to do like an ROI or something, they wouldn't usually do that. Or sometimes they would if you asked for it specifically. But I think, for practices, I think really one of the problems is there's just a lot of confusion. And that's why I think this topic is so big, is because there's a lot of companies out there that promise different things. You have the reporting that is already in your system. So you oftentimes think, well, why do I need anything more? And it's just being able to understand what are those metrics and what do you need to bring together so that you can have just a better vision of your practice. So I think, in just my experience over 20 some years, there's always just been a lot of confusion around it. Are we doing the right thing? Are we looking at the right numbers? Things like that.
What types of personas are practices looking to fill this void, this data person, this analyst person? And you said it was typically you and your experience of practices. What was your title? What was your job role and function when you were kind of tagged with being that analytical person?
It was just office manager, practice administrator. It's kind of had different titles depending on which organization that you're working with. And I think that's sometimes the hard part when you're hiring staff, is because you can have different titles across different organizations, whether it's coming from a hospital, from, just a regular privately owned practice or something like that might have the same title. And so you might assume that you're getting the same skills in somebody that you had previously that maybe was running those reports, and you may not have it later. So, but office manager, practice manager, just typically the two. And then, like I said, the accounting teams were the other ones.
Well, and from my experience, a lot of times the accountant team is not even an in-house team. It's a local accountant practice until you get to a certain size organization where you start bringing finance and accounting in-house. But oftentimes in the earlier days, it's kind of a, third party that's doing it. And even so, they're very focused on the balance sheet, income statement, not necessarily all the day-to-day provider schedules and, looking at the different patient mix and zip codes that they're coming from and trying to figure out how you grow and expand, or the marketing side. But as a practice administrator, which I think that's common, by the way, that's really common to say, you're a practice administrator. You should know what's going on in the business. Therefore, you should look at the reports and analyze the data and figure out how to export it from your EMR, your PM system, your HRIS system, what the list goes on. If you're using a CRM for your patients with marketing and email outreach and those types of things, or call center data, you're the practice administrator. You should know all this stuff. So just figure out how to manipulate the data and do it. But what are the other responsibilities that you're fighting with, right? Like what are typically, from your experience, what is a practice administrator? If they're not doing analytics, what are they doing within the practice?
A little bit of everything. They could be, where do I start? I have laid tile. I have vacuum floors. No, registering patients.
All hands on
I
deck.
laugh, but it's true. Cleaning bathrooms, things like that. But they're also managing the staff. So you got the HR aspect of it, hiring, firing, coaching, all of that. Typically, the administrator's doing that. If they're lucky, they have a nurse administrator that's able to take care of some of that and possibly offload some of the clinical reporting. But in the last 10 years, you usually don't have that many RNs within the organization. You have a lot more medical assistants and things like that. So a lot of times you won't have that oversight. If somebody's out sick, then they're up front registering patients, checking in patients, or bringing patients back and doing their intake and seeing what medications they're on, or sometimes they're assisting with procedures. I also led Tai Chi classes in the middle of the day, and then also and a lot of people are also the billing manager as well. So sometimes it's as deep as going in and physically keying in the bills that come in and the ERAs and EOBs and sending out statements. I'm also really good at sending statements out and putting those, getting them stamped. I was really happy when we had a machine that actually sealed it and stamped it for me. So
yeah, look at those the old school automations right there.
I mean, it was kind of like just one of those days when that happened. I was like, this is the best thing ever.
Yeah.
But you're sometimes the marketing person too. And other practices, I was going out and looking at new sites and, working with real estate agents. So, a practice administrator, depending on the office, the size of it, things like that, they could be doing a lot of things. A couple of my practices, I had each practice was at least 30 miles apart. So, during the day, you'd have to drive over to another office and things like that. So, when it comes down to sitting there and merging data and things like that, it could oftentimes be one of the last things that is done, especially when you need to pay the bills, right? So you don't want the lights to be turned off. That looks bad in a doctor's office. Yeah. And staff always wants to get paid. Oh, I forgot. Usually you're the payroll manager as well.
Yeah.
So staff, physicians, they all want to get paid. So you got to make sure that you're doing that biweekly. So it's often one of those odd things that is maybe something done as a special project or something like that. So
if I was to recap a lot of what you were saying, the office administrator could have multiple offices, have to travel between those offices, has general responsibility for staffing, knowing when schedules are, somebody asks for PTO and they're out of the office, and backfilling for them, actually backfilling and doing some of that work. And then there's a chief problem solver approach to it as well, where they're the ones that have to essentially read and react to different changes in the practice that are impacting patient experience, employee experience, training plans for individuals. I would imagine a lot of documentation of those workflows within the EMR and the PM. So how to register patients and schedule patients. I would also imagine certain things around working alongside of providers to get their provider template schedule, or the schedule templates implemented and optimized for that provider, along with the guide rails of the practice itself. I can see how it's a very data-driven role. Therefore, it immediately kind of makes sense to say, okay, well, you should be the person who's cleansing the data and putting it into a platform that you can use it yourself, because you're the one that's going to have to be data driven. You got to figure all this stuff out. If I listen to that whole list, if I want that individual in my practice to be successful, it would make a lot more sense to make reports, analytics, and otherwise that are more automated, that it's ingesting and cleansing all that process beforehand. And maybe Excel's not the right tool. Once you get to a certain scale, you have to look at business intelligence solutions. You have to look at data warehousing. Even on a smaller scale, you can use Excel, you can have templates, but there is a distinct difference in my experience of somebody who is learning Excel on the fly, who's picking up the prior person's template, compared to an absolute Excel guru specialist who knows how to use Power Pivot and other advanced features, and even take Excel and connect it to a data warehousing solution or to other platforms as well. And you're always going to be limited by how much data you can manage within Excel. And hopefully, if you're listening to this, your practice has grown to the point where that's challenging to manage, meaning 1 million records, like 1 million line items. And so you always want to get access to detail. But yeah, that's asking a lot of somebody to say, hey, not only do you have to look at the data, you have to cleanse it all. It's not uncommon. And in my own experience, as I grew up as a consultant, primarily on the revenue cycle side, and it was my job to do that data cleansing when we had a project. And what I discovered is I could literally spend days building those initial templates, building a process to extract data from a report from the EMR. And I air quote the word report, because there's this misconception that your host systems, whether it's your HRIS, your EMR, your call center data system, that they're going to have these beautiful dashboards. Everything's going to be perfect. And you can even customize it. There's always the sales pitch around customizing it. But there's always a point of friction somewhere along the way where you have to extract the data to really analyze it and drill into the detail and be able to manipulate it. There's always going to be this portion that you have to extract to Excel. And so that was my job, was extracting it. And I would literally spend days as a high dollar per hour consultant in my prior life doing that work to build these templates and build these modules. And now fast forward a number of years, and I've worked with technologies that can do all this stuff so much more rapidly, right? And so much more automated, and they exist, and people don't always know that it's true. But yeah, a data pipeline solutions like Azure Data Factory, or if you have Microsoft Fabric, these are really popular tools right now. Data warehousing solutions and BI, they can automate and streamline that. So what I've seen is the benefit. And I think you could echo this too from your experience working with different practices. What I've seen as a benefit is now you're skipping a whole step that could take days or hours of extracting and importing data into some common spot. And now you're actually analyzing and looking at the data. And as an administrator, that seems to be way more efficient to say, hey, on Monday, I'm combing through my dashboards. On Tuesday, I'm training and coaching. On Wednesday, I'm doing whatever. But, it's not uncommon to have a weekly KPI dashboard that you're analyzing on Monday, and then you spend the rest of the week maybe finding the top priority, drilling into the details.
Absolutely. And I think, one of the qualities in most practice administrators is just that ability to see something, to see whatever whatever site you're in, and go, okay, I know how we could do this better. And by being able to have that data, because they are most of them are very data driven, but like you said, sometimes it's just the cumbersome, aspect of capturing all that data, bringing it in, things like that. So when they have that information, they're able to jump and leap so much faster and make changes, and recognize. And I think that's one of the bigger parts. You have people who can pull data together, but there's a different aspect of recognizing what it means to the practice. And I think that's where most practice administrators excel at, is that they're able to take that and really analyze it. Maybe they were properly trained in it years ago, or they never were, and it's just something they inhabited, but they're able to see that and go, okay, here's what I can do, and I can affect this change just by tweaking this and this and this. And now we've got a better workflow, we got a better process, better schedule, or whatever it is. And then they're able to follow up on it and go, yeah, I was right. Not in that type of sense, but there's some validation as you see the numbers start to improve. So
one of the things I often like to say is there's a cost to not knowing. As an experienced professional, you can run a practice on gut and you can do just okay. But if you can't see all the data in front of you to properly prioritize the highest opportunities or visualize where the deficiencies are, maybe it's some sort of a credentialing denial, things like that. You recognize you're not getting paid. That's what your gut tells you. You understand, I had all these services, but they're not getting paid. But if you don't have the data in front of you, the claim adjustment reason codes, the remark codes, to analyze it, there's a cost to not knowing that detail every day that goes by and being able to prioritize the right things. The reality is we all have one pie chart of time. There's 24 hours in a day. We all share that same amount of capacity, and solving problems takes capacity. That's the currency of problem solving, is time. And so time to research, time to develop, time to train the next person to do it, but it's always time. And so if you can accelerate through technology, being able to digest, cleanse data, visualize the data, if you can accelerate that, there's an immense value in knowing. Here's the reality of the healthcare industry. Our healthcare providers in the US are some of the smartest people in the entire country. They go through massive amounts of schooling and education, as they should, and they're incredibly brilliant minds. And these minds aren't given, in my opinion, they're not given the proper tools to visualize and see all the data to run their practice or their business, right? And so I lean heavily on the rev cycle side and the finance side, but clinically as well. If you put great dashboards with great UI in front of brilliant minds, they will much more easily be able to identify where the opportunities lie, prioritize them, ultimately helping their patients, hopefully expanding their practice, hopefully reaching more lives within their community with the insights that they're driving from it. So again, there's a cost to not knowing. As soon as you see this information and you put this in front of brilliant people, actions will be prioritized and things will get done. And that's your last point too, about monitoring the success of initiatives.
I agree with you 100%. I have worked with some practice administrators that have amazing spreadsheets. I mean, I've looked at them and I've been like, wow, this is just all the data points that they're pulling in, and it's just a massive spreadsheet. And it requires a lot of work. And likewise, when I left private practice, I left the new manager coming in with enormous spreadsheets of, month over month financials and things like that, and had to do a full on training session. We trained for months with her for her to learn how I did it and how I pulled it all together, so that moving forward, you were still, apples to apples. And I think, and you talked about that a little bit beforehand, is, that training aspect and all of that. And so just the amount of time to make sure that, because we had commissions, things like that needed to be calculated. And so all of that was pulled into those Excel spreadsheets, and pulling all those in together. Really, I had to spend at least 30 days working with her and making sure that she had it correct, so that as I left, the information was still the same going forward. So 100% to your point, there's some amazing Excel spreadsheets that are living out there, but they require a lot of work and then a lot of training,
Yep.
to be able to keep somebody on that same path and same course.
Yeah. And then you have to have somebody that comes in with a similar level of understanding on the technical side of how to manage that spreadsheet, how to export that data. And it's really a whole specific job for it. And I've heard people go down the path of, well, can I just hire an intern to pick this up, or a junior level resource? The reality is, sure you can, but you still have to go through the same training. Like, you still have to do that for that resource. And so getting somebody off the street that's going to know how to do all that technical nature of things, there are more expensive resources, the reality, as far as having that technical skill set. But there becomes a point where it's a significant ROI. I'll use one other example that came to mind, because you were talking about the practice administrator role and just some of the things that you have going on. If you really want your team to be successful, and I'm talking about your practice administrators, even your front desk staff schedulers, your billers and collectors, whatever the position is, if you really want them to be successful, you need to give them the tools and the automations to be more productive and have better quality. And one of those tools is the analytics. Right? So if you have the data cleansing component being done for you, you have the dashboards, and not just the dashboards, but subscriptions, alerts. If a KPI goes at a threshold or something that you need something needs to get brought to your attention. If you have these pieces of the puzzle in place, it is equivalent to James Bond having certain gadgets, right? James Bond, fantastic spy and whatever, but as soon as he has rockets coming out of his car and all sorts of other stuff, he's so much more effective. Batman and his utility belt, right? The list goes on. Yeah, 100%. So you might have an administrator, they're the James Bond of your practice. They're just fantastic. They're great. But they may not have all the tools to optimize just how good they could be. And as a leader, you have to take a step back and say, I need to build the organization that they can be successful within, and they want to stay within, because they never want to lose that person. And if they look over their shoulder and they see like, hey, they got more widgets and gizmos and gadgets at practice ABC, 20 miles away, that might be more appealing because they want to be more productive. Great people. One thing that my parents taught me and I learned through growing up is good work is rewarded with more work. One thing that I've learned is, while that's true, good work is rewarded with more work. You want to have the tools to actually be able to work smarter, not harder. And this is one of those mechanisms or tools to get that done. How do you work smarter, not harder at a certain task?
Now, I have a couple of really great things that have just happened within the last week that I want to share with you. But I think one thing that's key, and I know something that I struggled with, and I think you would have a lot of insight on this. One of the things we talked about, all the different people that could be doing this and hiring within. What do they look for in doing this? Like if I'm a practice manager, I've got 10 offices, 20 some physicians, things like that, and my spreadsheets are just almost breaking my computer, type of thing. And I'm spending hours on them. Like, what is that person going to look for? What do they really need to be able to be successful?
There's a lot of different things. I'll tell you what I would look for is the diamond in the rough. And that is exactly what I've looked for in my own practice to build my own team. And I echo the diamond in the rough. There's not many individuals that check all of these boxes. And so as I talk through it, I think for the listener, there's a moment of reflection to say, what am I good at in terms of training the gaps, or what things, am I comfortable with leaving off the table to find the right resource and cultural fit? But what I look for is somebody, one, that's been an IT professional. And so you'd look for certain buzzwords or acronyms within their resume. Have they done extract, transform, and load, or ETL? Some people call it ELT now, extract, load, and transform. But you're looking for data engineering skills, data pipeline skills. That is the mechanism to move data from your practice management software into an analytics solution. So can they move data? You look for data pipeline, ETL. You may see the word API come up from time to time, but there's certain buzzwords around that you'd look for. And then you want to look to see, do they have a portfolio of Excel-based templates and dashboards, Power BI, Tableau? A lot of the resumes that I'm reviewing right now do come with a link to a website, and it has sample portfolio of dashboards and information. I was just recently a guest on a podcast, and it was for an organization that specializes in training upcoming analysts, people who want to get into the analyst profession. And one of the things that they have at the end of their program is a capstone project, and they create these websites. And they have hundreds of students go through this course every single year, maybe thousands, actually. It's a rather large program. And so the reality is these people are out there that have essentially proven that they can do the work. They've proven that they've had the experience doing it. And one of the most critical things that I would look for is they have healthcare experience. So what I've noticed in most organizations is they overestimate their capability to train and onboard technical staff. They believe that, if they're just in our environment, they'll just naturally absorb our language, our acronyms, and what's going on. But the reality is, it takes years. It takes years of being a fly on the wall, of understanding things. It takes job shadowing and experience, being side by side, shoulder to shoulder with individuals. So it's not easy to understand any of the details around scheduling, around billing, around clinical documentation, concepts around ICD-10 codes, modifiers for CPTs. And so if you're going to be asking somebody to put dashboard together of give me the top CPTs that have these modifiers, and so we need to drill into these modifiers to see if we're getting paid for the left and the right, they're not going to have a clue how to approach that. And what that means to you is you're going to spend just as much time training them as they're going to spend on actually developing the dashboards themselves. And so I wouldn't look for somebody that has every single skill in clinical, operational, and financial management in terms of having background in it, but at least find the one that you say, we could support this one the closest. We're really good at rev cycle. We have a great rev cycle team and leader, great trainer. And so maybe we're going to lean more into training on the clinical side, right? And so you just find the right fit for you. Those are the areas that I would look for. The last thing that I would say is you should always ask somebody, how do they continually educate themselves? Who do they follow on YouTube or social media? Or have they gone to training programs? Are they part of groups or committees? But you want somebody who's self-motivated because the landscape of technology is changing rapidly. And so you want somebody who's truly passionate about data and data analytics. So look for those types of things either in the resume or in an interview conversation with them. And that's what we do at our side at Parable. That's what we do. We look for people. They have to have healthcare experience or background. We specifically target that population. We specifically target people that have active experience. So we don't really do anything in terms of college hires. And that's because we recognize that our training is really, really good, but it doesn't start at zero. Our training starts at usually somebody that has 2 years of experience. It's kind of the beginning point that we would target. Of course, there's outliers, and we always look for more seasoned professionals. We usually have to have somebody that's had some experience elsewhere prior to working here. And then the common stack, tech stack that is, so using things like Power BI, Tableau, do they have portfolios, and those types of things. But then when we get into interviews, I've always been known to ask people, who do you follow? What books do you read? And I'm seeking to understand, are they motivated to do this long term? It's really hard. What I just articulated is really hard to find. And that's why we exist. So, and here's another reality too. I think this is worthwhile because if somebody's listening to this, they're like, I'm never going to find that person. And even if I did find that person, you're right, Jason, I'm not equipped to train that person. Here's some of the places you might look that I would recommend against or not going in this path or direction. So it'd be really common to say, well, I'm going to call my MSP, my IT service provider who does my help desk ticketing. And they said they can stand up a data warehouse or a data lake house. So let's talk to them. You can have that conversation, but you need to look for really hyper specific examples where they solve the ad hoc questions, the things that you have, like, have you solved for financial modeling and forecasting? Have you solved for cash waterfalls? Have you solved for AR management, denial management? The list goes on of things that you might be feeling in your practice. My guess is, and what I've seen in the past, is most of these organizations, they're excellent at getting you the right licenses, negotiating those licenses, managing the general IT support, even standing up a data warehouse at the most basic level, but not necessarily where you have to move into an absolute deep expertise. So managing a scalable data model where performance matters. When you write a query, you want it to yield a result rapidly, or you want to fill a dashboard with information that's dynamic. When I click on it, it moves. A lot of EMRs, because of the amount of data they work with, a lot of EMRs are very slow. They're in-house reporting. I've seen it where you either click reports and nothing is alive, nothing's moving fast enough, especially as you grow as a practice. And then I've seen it before where you actually have to schedule reports. You pick your criteria, you schedule it, and then it spins and it says, we'll send you an email when it's ready. It's not perfect. Now I got to go change everything again. And you're just burning all this time waiting for a response. So those IT professionals are typically really good at what they do with those quick turnaround help desk support. My email's not working. I can't get this program up and running, et cetera, et cetera. Deep expertise in data warehousing and analyst services. So if you are talking to a vendor, have you solved these problems? Have you solved anything around schedule optimization? Have you solved anything around provider compensation models and automating those? Something, whatever your biggest pain points you feel are, something has to be accomplished by that professional or that group. And I've seen it where that's usually not the case. And the last one is, you may talk to a SaaS company or software company, and they say, we've got canned reports that do all this stuff. All you have to do, sign up, and we plug all of your systems in, and it's ready. What I've seen there is they're too rigid. You also have to have a moment of reflection, look in the mirror and say, you know what, I am different as a practice, as a business owner. I have listened, I've read the books, I've listened to other people in presentations and conferences, but I don't do everything exactly the same way. So the way I calculate my measure is different, and for good reason. The staff that I hired is different. My job description for a practice manager is completely different than Aaron's down the street, and that's okay. And so when you have those differences, even differences in tech stack, where you have maybe one EMR, a different PM system, something around the patient payment and portal, within your website, that means you need to have something more complex built and tailored custom white glove to your practice. And that threshold I've seen in the past, typically somewhere around 20 providers in specialty care, is where it starts to get really painful. Sometimes earlier, but generally speaking, that's where it gets to be painful. And then it's unbearable once you get to like 40, 50, 60. It's just like, I can't manage this anymore. I need that customization because I'm sick and tired of logging in and out of 6 different applications, none of which perfectly depict the story that I need. I'm still exporting information. And even this SaaS solution that I bought that just automatically layers on top, it just gave me one login, but I have all the same problems. I still have to extract data. I'm still not getting the custom reports that I want. I don't have the alerts that I wish I had to just tell me, when do I have to look into this report? And when I submit a ticket for help, at least my MSP is responsive, but this company, they're not giving me immediate responsiveness. And when they do respond, they'll tell me, oh, that report is going to go into a sprint for Q4 and it'll be released in Q1 of 26. And you don't have that much time to wait. So have it, consider having somebody internal, and consider having, if you can't find the right resource, if you don't feel like you can grow, manage, or identify the right resource, then do the research on what organizations, you can bring in to basically outsource that function within your practice, but still be part of your practice. You got me fired up, Aaron. That was a rant. That was...
But it's key because you're inundated with so much information. You go to the conferences, you've got different vendors reaching out to you, and it's overwhelming, as we already talked about. As a physician owner, the practice administrator, things they're doing other things in their day, and those are some of the quick things like, hey, what do I look for? So I think you explained it perfectly. So
yeah, and obviously I'm passionate about it. I'm a no excuses person, and I feel like you have to, if there is a legitimate excuse, you have to remove it. And so if your excuse is I didn't know, there's a cost to not knowing, right? So let's remove that. Let's make sure that you know what's happening, when it's happening, and you have the data to support it. So yeah, I'm passionate about it, and I think it's creating a point of friction in growing and expanding healthcare in the U.S., and that's my mission to alleviate that friction, make it so the right
absolutely.
smart people can make the right decisions. All right. Well, that fired me up. So probably a good point to kind of bring it to a conclusion and get an opportunity to come down a little bit. Any closing thoughts, words of wisdom for practice managers who are the Excel guru in their practice? Any kind of closing statements?
I do. There's hope. There's hope out there. I'm going to explain it with something that no kidding, just happened yesterday. We're meeting with a client, and they've been working in their reports. They're like, what I'd really love to see in here is, when I look at my, physical therapy charges, which of my payers are having the highest paying out. How would I need to maybe manage my system to be able to look at that? And I took a look at it for them, and while we are spinning up a very specific ROI report for them on that and a bunch of other different measures, different special procedures that they do, and things like that, really within less than a half an hour, I was able to get that information, pull it all together, and send it over to them. And that would never have happened, years ago, just working out of just the regular data. The core reports that we already had built out for them, I just took a look at 2 or 3 different things and just brought it together for them. And we already had an answer to, what they were looking for. And it just was, you're able to take, something that, like I said, would have probably required hours and hours of, pulling data together The dashboards were already there. We're able to see that information, go to another one for just a little bit more, just a different view, and then drop into the detail really quickly. And that's the key, is sometimes you need to get into that detail aspect. You could have a big, beautiful graph, but if you can't get into the detail to validate, sometimes it's not worth it. So we're able to validate that information, and they had that information about 30 minutes later. So
Well, I mean,
it's
so yeah, that's the silver lining. There are tools, templates, mechanisms to build that infrastructure so you're held accountable only for the execution, right? So now you can see what's happening, and you're not held accountable for why didn't you see that? Why didn't you know that? Like, it's there. The ability to find the details is there. And now, are you able to get stuff done, make change in your practice, put an action plan together to resolve something? Um,
absolutely.
yeah.
So,
And for a chief problem solver, like the practice managers are, I think that should sound really appealing to say, like, hey, like, you don't have to hunt for an opportunity. They're right there. You have to pick the right one and just put the action plan together to solve it, and then reap the rewards on the other side.
absolutely.
Oh,
So
cool.
that was my big exciting
It's a great story. It's a
thing
great
from
story. And it's
yesterday.
real, like a real practice example too, real life in the practice what they're going through. All right.
Mm-hmm.
With that, thank you so much for joining and listening. For those that listen, thank you for joining, Aaron. If you are a practice or organization that would like to dip your toes in the water with analytics or a data team, or learn more if it's the right time, size, or fit for you, feel free to follow me on LinkedIn, Jason Brill, Bryll, founder of Parable Associates on LinkedIn. And also, please follow our business on LinkedIn. We're going to post as many videos as we possibly can to educate you on data in your practice. So it's Parable Associates. You can find us on LinkedIn or at our website, parableassociates.com. Thanks, everybody. Appreciate your time.